Namaste and welcome to Speak for Health. This is my podcast, and I am Dr. Daya Prasad Kulkarni, founder and director of Arogya Seva. We are in season 4, episode 3. This season is called Vidya Ropana, Holistic Healing Through Knowledge of Chronic Diseases. The series is brought to you in association with One Health Education Inc., Arogya Seva, and Twin Epidemic. We talked about diabetes, we talked about hypertension. The third thing that comes in combination with all of this is cholesterol. Everyone talks about cholesterol, everyone talks about different types of cholesterol, high cholesterol, low cholesterol, its effects, what foods have, you should eat, should not eat, so you don't have cholesterol. So there is a lot of information about cholesterol out there. Um, there is also a lot of misinformation. We need to understand what is cholesterol first. Is it good to have it in our body? Should it be there? If it should, then to what extent? And how do we, what are the impacts of this on us, on our health? And how do we control and monitor that if at all we need to do it, right? So there is a lot to discuss around this important topic of cholesterol, which is kind of goes hand in hand with diabetes and hypertension, right? So to talk about this and to give us an introduction, we, as per usual, we have with us today Dr. Kris Vijay, who's a clinical professor of medicine at University of Arizona and also the president of the nonprofit Twin Epidemic. He is also the series director of Speak for Health Series 4, right? So to get us started, this is going to be a lengthy topic, so we will have a two-part session for this particular topic. The first session is going to be more about understanding what cholesterol is, and then in the follow-up session we will have a few experts as usual joining us. And to make up, since we don't have any guests today, we will have two guests in the follow-up session, right? So to get started, I will invite Dr. Kris to take us through um, his explanation of what is cholesterol and why we need to learn more about it. Over to you, Dr. Kris.
Thank you. Thank you so much, Dr. Daya. As always, it's such an honor and humbled by your presence and also, my input. I'm truly blessed to be here to talk about important topics. And as Daya mentioned, holistic healing through knowledge. And we have to bring in the physical, we have to bring in the intellectual, we have to bring in the mental, and then we also have to bring in the spiritual component of it all. So how do we do all of that and yet have a good quality of life and have a good longevity and make an impact on other people's lives? And your own is first. Just like they say in a plane, when the oxygen level drops, you have to put the mask on yourself first, and only then you can help the child or anyone else around you who is helpless. And so first is to take care of yourself so you can take care of others. And you can take care of others, but you cannot take care of others if you yourself are not in the best of shape, best of physical, best of intellectual, best of mental, and best of spiritual. So let's now walk you through the basics of cholesterol. And we'll also talk a little bit in detail as we move forward through the discussion and my presentation on some of the advanced aspects of cholesterol. Because in the next session, you will get two experts who really are at a much higher level of thinking process, that they will talk in an advanced way. But for that, and for you to really follow through that, some basics are needed. So let's talk about some basics of cholesterol. So let's go to the first slide. So cholesterol, we're going to talk about from basics to advanced. And the next slide is talking about what this part one, and it'll be about cholesterol as a silent killer. So this is a clip from a newspaper in the 1980s where they are talking about cholesterol being a silent killer already. Why is that? Because there is a large study called the Framingham Heart Trial. Comes from a small city called Framingham in Massachusetts, where they had almost 350,000 people, and now the population has gone higher, and they've been following them all along for almost 40 plus years, and they're learning so much. How do we know that smoking is harmful? How do we know blood pressure is harmful? How do we know high blood sugar is harmful? How do we know cholesterol is a silent killer? Well, it's because of the what is called the population health trial, the Framingham trial. And when that was coming on, they realized that, hey, cholesterol needs to be suppressed, the bad cholesterol needs to be suppressed. And so they did what is called the 4S trial, and the S stands for Scandinavian simvastatin suppression trial, where they wanted to suppress the LDL cholesterol and see whether that would make an impact on preventing heart attack, preventing strokes, and also making us live longer. So that is the reason in the 1980s, when they started that thought, now 40 years later, we're still debating about cholesterol. It's very obvious that the bad cholesterol is, there is a linear, a straight line relationship between high bad cholesterol, which is called LDL, we'll talk about that, and heart attack and stroke and death. So clearly there is a linear relationship. So we need to continue to mention that and not believe in the misinformation that cholesterol is, that the bad cholesterol is not harmful. You need it. You do need some of it. We'll talk about that. The next slide is about what is cholesterol. So as you see in the picture, you have food and then you also have liver. So we have cholesterol that is associated with fatty foods, and most of the waxy substance is made in our own bodies. Actually, the liver produces 75% of the cholesterol that is circulating in the blood, and the other 25% comes from the food. And when you actually take care of a healthier diet, you do, some people have an impact for somewhere around 10 to 15% for the most part in reducing the LDL. But then some others may have this gene which is called the Niemann-Pick gene. And if one has Niemann-Pick gene, which don't measure routinely, but if you have that, you can have as much as 25% reduction in the bad cholesterol when you control your diet. So clearly, there are opportunities to get the LDL cholesterol to normal levels. So next slide. Yes, cholesterol is consists of what is called the bad cholesterol, which is the LDL. Lower the better. L is the lousy cholesterol, or LDL is the lousy cholesterol. L stands for lower the better. And the HDL is the healthy cholesterol. Higher, H stands for higher the better. And H is the healthier one, right? So yes, clearly people older than 20 years, they're recommending now, should have the cholesterol check. Why? Because 75% of all the LDL cholesterol is genetically driven. And so you have to do a simple blood test, it's fasting, and it measures different kinds of cholesterol. You can do non-fasting if your triglyceride level, which is the in between the three types, we'll talk about the three. LDL is the lousy, the HDL is the healthy. In between, there is something called the triglyceride, and 1/5 of the triglyceride goes to form the total cholesterol. So we'll talk about why that is important as well. And so, if the triglyceride is normal when you are doing fasting, and the triglyceride is normal, the next time around you don't have to do fasting. You can do non-fasting cholesterol levels, because triglyceride goes up when you eat. And if it doesn't go up above a certain level, then you'll be okay. It can measure LDL accurately as well, non-fasting or fasting. Next slide. And most of the cholesterol in the blood is really carried by these proteins. So that's what LDL is. LDL is low density lipoprotein, or LDL. It's a protein that carries the cholesterol. So this carries the bad cholesterol, because it really combines with many of these substances to clog the arteries. Why do we need to keep the LDL level low? Because it can block the arteries in the heart, which causes the heart attack. and block the arteries in the brain or arteries going to the brain, and that can cause a stroke. A diet high in saturated fat and trans fat tends to raise the level of LDL cholesterol. For most people, LDL somewhere around 100 is healthy, but I can tell you the guidelines are changing. We used to think that 160 of LDL was okay. 190 of LDL or more is considered as what is called familial hypercholesterolemia. That means it's genetically driven. There are receptors on the liver surface which glob up the LDL cholesterol from the bloodstream. I don't know if you guys remember what is called Pac-Man. You may have played the game of Pac-Man. It got his mouth open and he keeps on gobbling up all its enemies. And so imagine the LDL receptor on the liver surface of the Pac-Man, and it takes the LDL cholesterol and then gets it into the liver and then gets it out of the GI tract. So the LDL receptors are like the Pac-Man, and you have only so many receptors because it's genetically driven. So then if you have low number of LDL receptors, your LDL cholesterol in the blood is going to be high, and this can clog the artery. So you want to know what your LDL is because it's genetically driven. And Indians have a very high genetically driven LDL cholesterol because of what is called PCSK9 gene or LDL receptor gene, or another one we'll talk towards the end of my presentation, and that's called lipoprotein little a, small a gene, is one of the highest in the Indian population, South Asian population. And so in South Asians, now the Lipid Association of India have come up with the guidelines, and I've been part of that for the last 7 years. And their most recent recommendation is that LDL should be less than 70 for everybody, because we assume that most of us have a genetic basis. And then for people who already have had a stent, or they have diabetes, or they have two risk factors, you need to get it even below 50 for Indians. And the Indian population, Dr. Puri, he will come next in a couple of weeks. He says bring it even closer to 30. You don't need LDL of 30 is safe. You need just about that. Fetal LDL is about 30 to 35, and that's how much you need. If anything more than that may be excess, and it can slowly accumulate and get the plaque build up inside the arteries. So get the LDL down as any which way you can, combination with diet, exercise, and maybe need for medications if the LDL is not coming down with diet alone. Next slide. And the good cholesterol is called HDL. So up to a third of the blood cholesterol is carried by HDL, the high density lipoprotein. And this one prevents building up of the plaque. So you need a balance between LDL and HDL. The LDL is high. If you have the HDL is on the higher side, between 40 and 80 is a good number. More than 80 or 100 or 120, people think it's good. Sometimes that can do harm, and that can also contribute to a plaque building up. Too much HDL is not good either. So a certain amount rightly in between optimum LDL. It is I look at HDL as the garbage truck. Think about the garbage truck collecting garbage from, in the US we say New York City, and New York City is filled up with a lot of garbage trucks going all over, from Manhattan, Queens, and Brooklyn and Bronx and Staten Island and Long Island. It collects all the garbage and brings it back, crosses over the George Washington Bridge, crosses the Lincoln Tunnel, comes over to the other side, and then goes out into multiple different golf courses and then dumps the garbage. So think of HDL as the garbage collector truck, which is now functionally, even if you have 10 and they're functioning properly, and it's a good thing. If you have 100 and they're non-functioning, because imagine the truck driver is being drunk, or the truck is not functioning because the tires are not there, the transformer is gone, or if the transmission is gone, or the brakes are not working properly, whichever way, or the roads, the George Washington Bridge is closed, or the Lincoln Tunnel is closed, whichever way, it's not able to bring the garbage back and dump it, and that can increase, and then the plaque can rupture and cause a heart attack. So that's why a balance of good HDL is very important, to be the garbage collector and collect the junk and throw it back, as long as it is functional. We can measure functionality of HDL now, above and beyond the number or the quantity. Next slide. And the triglyceride is the guy in between. So they're trying to get in between, TG, triglyceride, trying to get in between the two, and the body converts excess calories, sugar, fat that is carried in the blood, and the fat cells are throughout the body. And like people who are overweight, people who have diabetes, people who drink alcohol, and people who are smokers, people who are obese, they may and try and hypothyroidism, they all can carry high triglyceride. And if you eat a high carb diet, the triglyceride goes up. So more than 150 is not good. We say even for Indian, South Asians, we should keep it somewhere closer to 100, because the triglyceride, one-fifth of the triglyceride. So imagine it's 150. So one-fifth of that is 30. So now anything, 30 of that is contributing to the plaque building up. VLDL, a very low density lipoprotein. That's the 30 number. That can now slowly bring in the plaque and accumulate inside. And they do it through what is called remnant lipoprotein. We call it RLP. That is an independent risk factor for building up plaques inside the arteries. People who are obese, people who have low HDL, they can have high triglyceride. There is also genetic conditions that make the triglyceride go up as well. Next slide. And this is where the picture looks like. They look at the LDL, it looks bigger, larger, but the density is low, whereas the HDL is a higher density and it's a smaller size, as you see over here. And the lipoprotein composition can be different, with different amount of proteins and different amount of cholesterol in each of these protein carriers of the cholesterol. Next slide. And so total cholesterol is again a LDL plus HDL plus one-fifth of the triglyceride. As I mentioned, some people want to measure the ratio between total cholesterol to HDL ratio. So that's what we used to do in the past. Now that is changing, because you can have total cholesterol that can be normal, and you can have an HDL that is on the higher side. And then you would believe that the ratio is low and I'm okay. But then your triglyceride can still be very high and contribute to the problem. The other thing, we call it non-HDL cholesterol, which is the triglyceride one-fifth plus the LDL is your non-HDL cholesterol. And if that can be high because triglyceride level is high, and the total cholesterol to HDL does not really reflect a lot of that ratio either. So the non-HDL is a better marker than just the total cholesterol to HDL ratio. Next slide. So this is where the ratio, as I mentioned. Next slide. So there you go. LDL is lousy cholesterol, HDL is healthy cholesterol, higher the better. Triglyceride trying to get in the middle, as they say, and the VLDL is the one that is one-fifth of that triglyceride, and that can cause harm and build. So again, obesity, diabetes, they all have high triglyceride. Bring the triglyceride down by controlling diet. You can control triglyceride level for more than 50% of the time. Next slide. So normal value total cholesterol, keep it less than 160 milligram per deciliter. I didn't put all of the metric there. But the LDL, we want to keep it less than 100 for everybody. As I said, the bar has come down from 160, and then now it's come down to 130. And most people now say 130 is good. And now they may change the bar again, because now we are realizing the lower the LDL, the better. With more intervention, with new therapies, people who are not able to tolerate some medications like statins, they have utilized other agents called PCSK9 antibody, ezetimibe, bempedoic acid, most recent one. We'll talk about that. And all of them are showing that when you drop the LDL down even closer to 30, you are preventing heart attacks, preventing strokes, and increasing longevity. So anybody who has any kind of plaque built up, we do now calcium scoring through coronary artery CT scan, which is non-invasive. In 8 minutes, you know exactly how much plaque is built up inside the arteries. And based on that, if it's more than 100, then clearly you need to be dropping your LDL below 50 for South Asians, below 70 for the rest of the world. And yes, I think it's maybe every one of us should know about the age of 30. I'm recommending everybody get the calcium score done so you know how much. Some I have had so many of them, 400 to 500. I had three patients when we screened them the last time, 1200 to 1400, and then we got their angiogram done. One of them actually had 99% blockage of the main artery, about to pop dead, and then suddenly we quickly got a bypass done, and he's doing extremely well. This is it, sudden death, and we don't even know why they died, and then we regret later on, oh my god, they had a massive heart attack. The massive heart attack is because left main can have 60-70% narrowing and no symptoms, and rupture suddenly and blocks it 100%, when suddenly either the high cholesterol meal, high fatty meal, high carbohydrate meal, it softens, the sugar softens the plaque inside the artery, and the softening means rupturing, like the drywall drops off, boom, 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 everything from underneath is now blocking the road, and that is a major heart attack. And that can have, or a high stress level, high blood pressure, anger, driving. So control anger. Krodhat bhavati sammoha, they say in Sanskrit. Sammohat smriti vibhramaha, smriti bhramshat buddhinashat pranashyati. From anger arises delusion, from delusion loss of memory, loss of memory to loss of wisdom, loss of wisdom, we die. It starts with anger. That means ego, anger and ego. When we keep it low and suppressed, that blood pressure doesn't go up. And that's our philosophy that is written in the Bhagavad Gita. Next slide. So prevalence of high cholesterol, 34 million people have familial high cholesterol, and the HE, or the it's not the homozygous but the heterozygous, is present in one third of the population across, who have plaque building up on top of perhaps a genetic basis. 55% of US adults, more than half, have high cholesterol in the US adults, and the cholesterol levels are precariously high in more than 100 million Indian population. You're talking about, almost one in eight, 10 people, or more, have high cholesterol. They didn't even know it. They don't even know it. Globally, a third of the population, a third of the ischemic heart disease, people who have heart attack, is attributable to high cholesterol. Overall, raised cholesterol estimated to cause 2.6 million deaths, according to WHO, and almost 30 million, we call it disability adjusted life year. That means 30 million people are disabled because of heart attacks, and because of cholesterol. And the global prevalence is now very high. Adults, almost 4 out of 10 people have high cholesterol, and most of them, both men and women, are almost equal. Next slide. So family history, very important. That's why we need to measure it, because it doesn't cause any symptoms. It's silent. And then diet may be a culprit for many 15 to 20% of the population. So saturated fat, cholesterol. We talk a little bit specific about the diet as we move on. So red meat is not good. Lean meat is okay. Chicken, fish is good. Some fish is good. I'll mention the type of fish that you want to focus on. Egg white is okay. The egg yolk contains cholesterol. Limit one yolk to 4 eggs. And then dairy products, some of them like full whole milk is not good. 1% to or 2% smaller quantity, and then skim milk is better. And then the higher cholesterol stems from a combination of 1/4 is from the diet, 3/4 is from the gene. If you already have a genetic predisposition, then clearly the diet component will add it to that genetic component and then cause problems with heart attack. Why even bother about not checking your cholesterol and making an impact on your lifestyle, and getting, to the extent that you can, bringing your LDL down? And then we can add some medications that one can tolerate and bring the LDL down as much as possible, with lots of medications that's available, safe and effective. Next slide. No symptoms with high cholesterol. They just block the artery. The first symptom may be a blocked artery with a heart attack, or requiring a stent, or requiring a bypass surgery. That's how dangerous this is. So know your numbers.
Right.
Know your numbers.
I think this is a good point to like pause.
Yeah.
So the we are always used to looking at the blood reports and looking at the numbers. People see oh, LDL, HDL, all these alphabets, all the numbers, but they don't understand. A lot of times doctors don't have time to explain what these numbers mean and where they should be and why they're important. So I think it was very, very simplistically explained what LDL, HDL is, what triglycerides are, and what where the numbers should lie. So even you know lay people have an understanding of their reports and then take informed decisions based on their own numbers, right? So this is very, very helpful, very informative. Along with that, we also got some interesting pearls. I think the Sanskrit shloka that you recited about anger, right? And how these are not just we're not just talking about clinical statistics from your blood. It's directly connected to your lifestyle, the way you're living your life, and everything is interconnected, right? So it is so important to look at your body, mind, holistically, right? And then understand why all of those aspects are so important. We will come to I think the additional factors that contribute to this shortly, but at this point we talked about numbers, right? You did talk about plaque formation and what happens and so on, but how can we understand better why is this cholesterol important, right? Why are these numbers so important, and what impact does it have, um, and why does it matter, right?
Yeah.
We talked about all of this. You touched up on a little bit about heart attacks and plaques and so on, but to understand that further, if you can go deeper into why does cholesterol matter so much.
Oh, absolutely right. So we always thank you there for that comment and appreciate that. So we always ask the simple question with any problem, any issue that we want to tackle. We always ask the five W's, right? What, where, which, when, and then the how comes in as well, right? So we talked about what is cholesterol. Now you're asking the question, why is it important? So let's go to my next slide. Let's see whether we can hone in down onto the aspect of why bringing the cholesterol down is very important. So this is the next part. So next slide is talking about the high cholesterol being a major risk factor uh, for heart attacks, for strokes, and it appears to also boost Alzheimer disease. So we have noticed again and again a linear relationship with high cholesterol, which may be at a subconscious, subclinical level, slowly is contributing to the plaque that is building up from inside into the blood vessel. It starts off outside the blood vessel in the wall and then slowly encroaches into the cavity of the blood vessel. By the time it occupies 75% of the circumference of a blood vessel, it already is a little bit too late in the game. And then we start realizing, oh my God, I need a stent or a bypass for the heart. But then in the brain, many times it doesn't give any symptoms until we have a stroke like symptom. Suddenly the speech goes down a little bit. The mouth is, on one side, you're not able to talk, or what is called dysarthria, or this, the articulation, dysphasia or dysarthria. And then also sometimes the visual eyesight becomes a little bit affected, and it may not be a full-fledged, full-blown stroke. It may be partial stroke. We call it TIA, transient ischemic attack. Dizziness, lightheadedness, speech difficulty, eye symptoms. So you need to quickly recognize many of that. And also, because the plaque is building up, one may never get a stroke, never get a TIA, but then they suddenly in their 60s or early 70s, they're now getting a little bit memory loss sooner in the life, and getting critical thinking process is being affected. They're not able to differentiate between what is priority right now, what is emergency right now, to what can wait for a week or two or three, and not able to discriminate between the two. If suddenly there is a poisonous, say, snake coming to attack you, or a tiger is coming to attack you, or if there is a cat on the side or a earthworm on the side, then you're not able to differentiate which one is going to be harmful to you. And now that's dementia, and that's Alzheimer's, and many times that's called critical thinking process, and it gets affected, and sooner in life than earlier, because of buildup of plaques in these arteries without causing any symptom. And that's why it's dangerous. That's why we need to know what the number is so we can bring it down. And this can restrict blood flow to the brain, because the cavity is, you want it this big, so the flow is good. But if it's slowly narrowing, but not enough to cause a heart attack, but the narrowing means lack of, like it happened yesterday in our own house, our heater suddenly burst. I think it's probably because the heater itself was getting junk. We probably didn't clear it for a whole year, and now the junk was accumulating inside, and the pressure built up, and boom, it was leaking, and the garage was all flooded yesterday. Whole day was gone. We got the plumber on an emergency, got it taken care of. We got a new heater, and today I took it this morning. I took my shower. The flow is beautiful. The water got heated up within a few seconds. Instead of it'll take a minute or two, I had to run the water the whole time, and then realize, why is it not heating up? Why is it not heating up? Well, because of the clogging. Simple analogy from real life is very true for our inside the body, what happens in these blood vessels. So let me tell you, the blood vessel, the inner lining of this blood vessel that occupies all of this, they're now from head to the toe, they're flowing from the heart. It spreads all over the body. The heart squeezes into the aorta, and from the aorta all the branches are going everywhere. What you see in this picture are the branches of the aorta that is now supplying to liver, kidney, the brain, every tissue in the body, all the way to your fingertips. And each of these blood vessels have inner lining called endothelium, and this endothelium has got all this normal functioning and buffer action, releasing cytokines and neurohormones, and also balancing clotting and bleeding. It also balancing constriction and dilatation. It has so many incredible functions. To stabilize the inner lining of the blood vessel is our purpose, so that it doesn't suddenly become disrupted and dysfunctional and block the artery. So that's what we're doing. Every time you eat healthy, every time you control blood pressure, blood sugar, cholesterol, and control your neurohormones through you're controlling your own inner feelings and emotions, and anger and hatred and jealousy and greed. When you control all of that, you are essentially controlling and stabilizing your inner lining, the endothelium. Some people call endothelium their god. You need to be in touch with your endothelium all the time, in every little thing that you do, from the minute you wake up till the minute you go to sleep. And even during sleep, the brain is continuously dynamic and functional. And once you've done your part, when you're conscious and at a subconscious level, now the brain is continuously forming all of those beautiful neurohormones that protects you when you're up and around. The next slide, please. So the plaque, as you see in this slide, is a little bit complicated, but that LDL that we talked about, the bad cholesterol, it gets oxidized. So we want to prevent oxidation of LDL. So when you eat unhealthy food or lack of exercise, or blood pressure goes up, blood sugar is high, they are now increasing some of these hormones and enzymes that allow the LDL to get oxidized. And once it gets oxidized, it is now forming what is called the foam cell, and foam cell is forming the plaque. So the first process is the oxidation. But even above that, you see a lot of those little tiny dots above on that corner on the left top on the Seattle northwestern corner, what is called ApoB. ApoB, we'll talk about that at the end of my conversation. And that is contributing to a part of the component and the backbone of the LDL. And independently, the ApoB itself can, if it is high, it can oxidize the LDL much faster and higher rate, and contribute to the plaque building up. Next slide. And this is how the inner lining of the blood vessel looks like. You have the cut open artery, one section. The left one is clean, and the one in the middle is got mild plaque building up, as you see all the colorful junk that's accumulating in the wall of the blood vessel. And then slowly it encroaches into the cavity. And suddenly the third one, you see that the narrowing of the cavity itself is very high, and it slowly builds up over time. But remember, the plaque that is only 20-30% built up, now 70% or more narrowing of the blood vessel can cause symptoms of chest pain when you walk or climb, or sudden chest pain with severe chest pain for an hour or two, and land up in the emergency room with a heart attack. But that happens because the plaque in the middle, you see, if that is 20, 30, 40%, it may not give you any symptom, but that is more at risk of rupturing suddenly like that because of all the other vulnerability of life, with blood pressure not controlled, blood sugar, cholesterol, stress level, and smoking. Smoking erodes that inner lining. The nicotine erodes the lining, and the plaque ruptures. And boom, suddenly there is like a volcano, and the Mount Vesuvius rupture, and then all the clotting factors from the inner lining of the blood vessel are now blocking that artery 100%. That's what happens suddenly. You say, my doctor said my stress test was normal last week. Why are you telling me I'm having a heart attack right now in the emergency room? Well, the stress test can be normal because it's only 30, 40% narrowed. Only when it's 70% or more, the stress test is positive, and then they do an angiogram and then put a stent. Now, remember, 30, 40% does not, it'll look normal. And then suddenly something happens in the trigger, and then it blocks it, and then a heart attack happens. And that's why people are confused about heart attack is a different animal, different pathobiology, a complete heart attack compared to angina, stable, little by little plaque accumulating with time, with life, with aging, with the risk factors that we talked about. It happens little by little, and then we can control that by preventing and reversing all the plaque accumulation as well. We'll talk about that. Next slide. So this is how the plaque looks like, the inner lining in the longitudinal fashion, clean, little bit of plaque, which is also at risk for rupture, and then slowly building up over time, narrowing the blood vessel. Next slide. And yeah, so this is a stroke. When there is a blocked artery going to the brain, that's a brain attack, or a stroke, heart attack, brain attack. Next slide. So these are all the risk factors. We talked about aging, talked about LDL cholesterol, the non-HDL I talked about, and then the low, the high density cholesterol, which is a good cholesterol. If it's too low, then that also can be a risk factor. But the functionality is important, as you mentioned. Diabetes, blood pressure, kidney disease, smoking, family history, obesity. We talked about all of that, and then even people who have insulin resistance with polycystic ovarian syndrome, also in women in the early in their life. Measure your cholesterol, keep it down, keep the diabetes, prevent onset of diabetes for PCOS. Lipoprotein little a, we're going to go there at the end. Some clotting factors and inflammation. So what happens with the sudden rupture of the plaque? You're increasing the inflammatory milieu by all of these uncontrolled risk factors, and including uncontrolled emotional feelings, and that is now increasing the CRP, C-reactive protein, which is an inflammatory marker, or LPPLA2, inflammatory marker, which is loosening up the plaque and then causing it to rupture or block partially or completely, causing that heart attack. So an unstable plaque plus inflammation equals a heart attack or a stroke. Next slide. So this is small in size, but essentially they're saying that bring your LDL line down below 100. Below 130 is what the rest of the world wants. And I say get it below 100, get it below 70 if you already have blocked arteries. And then if you're a South Asian, get it below 55. That should be the number. Target below 55 for if you have any little plaque building up inside, including if you have coronary artery calcium that you detect through coronary artery. So we're doing a next week, we're doing a large screening event in the park, and then we are going to be giving coupons out for the coronary artery calcium. It used to cost $500. Now it's come down to $100. We're giving it for $50 coupon so that people can actually have access to their own coronary artery assessment and anatomy and evaluation, and be energized and proactive about taking care of yourself. Next slide. So yeah, so Daya, any questions or anything that we go to the next in terms of the diet and what it entails and what the treatment strategies are available?
Yeah, I think, like, as you took us through these next steps, it clearly shows that cholesterol is an integral part of our daily lives in so many different ways. But it's not just that, right? There are so many other factors that might also influence the amount of cholesterol we have, or the amount of cholesterol we accumulate, and how that accumulated cholesterol impacts our health indirectly through impacting the blood vessels and so on, right? So I'm pretty sure, like we have stress affecting hypertension in so many ways, or our daily routines, or our other activities that we're doing. You did mention smoking, alcohol, and some other things. So what are these other various factors that you think we interact with, we engage with in our day-to-day life, that impact our cholesterol directly or indirectly, and how can we one, be aware of those, and then have informed choices to manage those in a way that we can control our cholesterol, which is conducive for longevity in some ways.
Absolutely, yeah. So nowadays, as you see, I was in India in August, and and then you go around in many in the U.S. or Africa. I was in Ghana, and then I was in Tanzania, and when I go around and observe and watch, what I'm noticing is that there is a concept of urbanization or globalization that is happening, and many places where I used to be in India when I was growing up, I left India. In 1980. But I go back, and when I go back to some of the villages where I noticed that I've had some connection with the village through my father's village or mother's village, and now I'm going to Pudukkottai in South India, and I'm realizing that it's not a village anymore. And I used to go to the river out there in near Tiruchi, where my mother's older sister used to live, and then we'd be going to the river, and we'll be bathing in the river. And when I was young, and now I go to Tiruchi, it's a big city. So the cities and the villages are merging with each other, and they're all forming cities. And obviously, the people are all now driving cars. So the reason I want to bring cars here is because that when you're driving, there is battery there which is making the car run, and you don't know if the battery is dead, then you're not able to drive the car. So the battery is a very important part, and we don't check the battery life on a regular basis. Do you continue to go open the hood and look at the battery life on a regular basis? We don't. When the battery is suddenly dead, you start crying, uncle, oh my god, oh my god, I got to change the battery and I don't have a ride. How do I, bro? In the US we call AAA, and in India, I don't know what they do, but the battery is dead. And that is what a heart attack is. You didn't check your cholesterol or blood pressure or blood sugar, and then suddenly the battery is dead, and you start crying, and you say, oh my God, oh my God, oh my God. So think about it with real life scenario, with some of those analogies. So the next slide is about the question that you asked, and let's address some of those questions. Martin, are you here? Okay, next slide is about the diet. So you asked, what are the triggers, what are the factors that also contribute to the plaque rupture above and beyond just that LDL cholesterol which is sitting there. Nobody cares, it may be 180 and you don't feel it and life goes on, but something else happens and then the trigger happens. So what are those components of trigger that triggers the plaque to rupture and cause that event? We call it a heart attack is an event. So the foods like too much egg, too much shrimp, too much lobster, or they're not completely forbidden. The American Heart came recently and said, hey, hold on, our the cholesterol from the diet is only about 15 to 20%, to 25 is what I mentioned earlier. Somewhere in that ballpark is what we think we know. So don't worry about the food, the cholesterol coming from food. But the answer is not completely right. So they now backed off from that recommendation. They said you do need to restrict. You can eat the eggs. It's not like completely stop eating eggs. You can eat the egg. Again, as I mentioned, one yolk to four, you do need some amount of cholesterol and fat that is in the egg yolk, which is important and healthy and important for membranes stabilization, for brain function, for neurohormones, and for enzyme production, from healthier cell function. You need a certain amount of all of this cholesterol, which forms a lot of the sterols and work in concert with all of the other proteins and carbohydrate and vitamins and oxidants, antioxidants, and everything together. But limit some of these, which is eggs and shrimps and lobster. Don't completely take it off your diet. If you eat seafood, then you can add it maybe once a week. A little bit of that is okay, restrict the quantity. That's important. Research shows that cholesterol that we eat do has an effect, but a few people are responders, as I mentioned. Some of the blood levels of cholesterol can drop significantly. LDL can drop just by altering the diet because you have the Niemann-Pick gene. So the diet limits are about 300 milligram for healthy people, 200 for those at higher risk. And then you remember, one egg is 186 milligrams of cholesterol. That means you're allowed to eat one egg with the yolk, in one day, because that's about all you can have. So people eat 2 or 4 eggs on a daily basis. So I would say you want to have 2 egg yolks in a day, fine, and eat a egg yolk maybe once a week or twice a week maximum. But then eat the egg yolk is does not have that much cholesterol. It's all mostly all protein stuff. Next slide. So food is important, and this gender. So some African Americans are at higher risk because they also have high blood pressure. You add cholesterol and high blood pressure, 75% of the population have the combination of the two. So don't think that you have high cholesterol is nothing is going to happen. Remember, your blood pressure tracks, and it's a silent killer again, as we talked a couple of weeks ago with Dr. Backrus. Blood pressure, you don't even know what it is, and it tracks with cholesterol 3/4 of the time in people. And so people who have the good cholesterol, the HDL, keep it somewhere around 80. So exercise improves it. Estrogen production peaks during childbearing years and drops off at menopause. So women's risk is about the same as men after the age of 55. So then women are now getting more and more heart attacks, almost equal to men. They used to be much lower. Not true anymore. Women are getting more diabetes than men. Women are having more high triglyceride than men. Women are getting more obese than men. Women are having more heart attacks and strokes than men. Women have high levels of homocystinemia than men. Gender is playing a big role. So yes, be all respectful of women in as a whole, because they are contributing so much to our lives on a daily basis. But beyond that, remember, women also are at risk. So make them be at peace with themselves. Cajole them, give them affection, give them all the love and the respect and the warmth that is needed, so that they can perform some unbelievable way. They can rule the whole world, and we need to help them to accomplish that. Next slide. And if you look at the ethnic origin, the Afro Americans, as I mentioned, are very high lipoprotein little a genetic marker. But the second highest is in South Asians and Indians. Indian American, there's a study, Dr. Enos, very close friend of mine, who is retired now, living in Chicago, did the first study of lipoprotein little a among doctors coming to the AAPI meeting, American Association of Physicians of India. Lord, he did their blood work and got a survey and did their cholesterol and LP little a. This is what he found: very high risk. And since then, so many other studies have showing that the lipoprotein little a, which is an independent marker, probably contributing to high risk of heart attack in Indians and African Americans. The lipoprotein little a does not seem to translate to heart attack, but in Indians it is. So know your lipoprotein little a. We are recommending checking it above the age of 20 from Lipid Association of India, and above the age of 30 for the rest of the high risk population. Because if it is high, we can do something about it, and we need to bring the LDL as low as we can if the lipoprotein little a is high, and new therapies are coming. We'll talk about that as well. Next slide. And in children, cholesterol, again, familial hypercholesterolemia, the Pediatric Association, American Association are recommending that people, if there is a family history, we need to check them at the age of somewhere between 2 to 19. Look at that. 2 to 19, it should be below 170 in people from 2 to 19. So they're recommending, if there is a family history, some father or mother or brother or sister have had a heart attack or a stroke in their early age, then even children now, pediatrics are saying, because some of the statins are now approved even for children, and they can bring down the LDL safely and effectively. Next slide. So what boosts your risk? Several factors. Again, diet high in saturated fat, family history, overweight, getting over. Next slide. So no more than 35% of your daily calories should come from fat. But not all the fats are equal. Saturated fats and trans fats are very high in some of the animal products, and tropical oils raise the LDL. Palm oil raise the LDL cholesterol. Coconut oil raises the LDL cholesterol. Don't be fooled by coconut oil. Coconut water is good. The pulp of the coconut is smaller amount of cholesterol. If you use small amount and then add it in food like South India, including Kerala, and in the Caribbean, they use coconut left and right. That is their food. But then they use the pulp, and then if you grind it with other spices, it may not be that bad. But then when you use coconut oil, it is enriched and it can increase the LDL cholesterol. It's not good. So a drop here and there is okay. It's good for the skin and good for the hair, but not to consume inside the body. Don't do that. That is the myth again. And then the other bad fats are again donuts. If we look at it over here, the avocado is a better, healthier food that has a healthier cholesterol. Again, no French fries or chips or even sticks of margarine, cookies. Unsaturated fat is better. You need some amount of that to have normal function. Olive oil is the Mediterranean is better. They say, some people say peanut oil is not good for you, and some others say it is okay. But I would say just be safe and use vegetable oil. Canola oil, some people is controversial, but I feel olive oil. Do not cook olive oil because the smoke point is too low, so you lose the benefit. But use it raw in salads, which may be better. And then avocado oil is a high smoke point. So if you want to use it for stir frying, I would say just avoid deep fried food anyway. And then use stir fried for with avocado oil, expensive, or vegetable oil, which is cheaper. And then use olive oil for raw, is just a little bit. And then avoid for the most part. And then eat lots of fruits and vegetables and nuts, which have a healthier oil. The pistachio nuts is healthier. Walnuts or these are the two nuts. Even almond, a little bit is okay, not too much. And then peanuts, I would say keep it on the lower end. Macadamia nuts, very, very low. Don't even use it. Hazelnuts, a little bit of magnesium is important. It's got a lot of magnesium. A little bit of hazelnuts is okay, not too much. But again, focus on pistachio and walnuts are the healthiest nuts that you can have. Next slide. Again, fiber, lots of fiber, lots of again, some cereals claim to be heart healthy. Be watch out for the sugar in the cereal. So low, zero sugar, high fiber, whole grain. Again, quinoa, quinoa, quinoa is how we pronounce it. And then protein breads are healthier. Oatmeal is healthier. Lots of fruits and vegetables. Among the fruits, the high sugar fruits are grapes and mangoes and pineapples are very high in sugar. So watch out for that. Again, dried fruits are okay. Lots of vegetables, a lot of salad every day. Every day for lunch, they have to have salads and add a little bit of olive oil and vinegar, and that should be the dressing. Beans are good for you. Lots of beans, which is healthier protein that you get. Next slide. And again, a low carb diet is extremely important, not only for keeping the blood sugar low, but also it brings up the HDL, the good cholesterol, higher if you eat low carbohydrate diet. Next slide. Smart proteins, again, lean meat, as you mentioned, chicken and turkey, and a lot of fish. Which fish is important? Which ones are they? There are 7 different fish. Salmon is the top. The sardines are okay. Tuna is okay. Again, sardines, if we get it in a can, wash it because a lot of salt in there. Tuna is okay. Mackerel is okay. Pomfret is okay. And then you have what is called sea bass. And then you have snapper if you're not allergic to any of that. And then the halibuts and trout. So those are the fish that I would say they're healthier. Do not eat tilapia. Do not eat swordfish. Those are the two with too much high fat, and it can become unhealthy. Tofu is okay, and then again it got some estrogen content, so be careful for women who have breast cancer or a risk for breast cancer. You got to be watching out to eat too much tofu. And American, again, Heart Association recommends fish twice a week if you eat fish. If not, if you're pure vegetarian or plant-based, that's even healthier. Then add beans and add a lot of nuts and again healthier legumes and proteins along with it and keep the carbohydrate low. Rice, brown rice and quinoa is healthier than white rice. Dr. Mohan talked about it. It's for our first white rice is directly related to increased blood sugar level and onset of diabetes in a pre-diabetic. So be careful. Next slide. Fruits and grains, we talked about raspberries and pears and apple. Eat the skin if you can. Chew the skin. If you're elderly, people take the skin out, but then crunch it, chop it out, or put it in a grinder and then make it like a smoothie or something, because the skin of the apple is extremely important, very healthy. Skin of the pear is extremely important, very healthy. Wash it, of course. And then all the berries, blueberries, strawberries, raspberries, blackberries, gooseberries, all extremely beneficial. A lot of antioxidant, which prevents the plaque from rupturing. That's exactly what we need. And a lot of fiber. Again, whole wheat, bran flakes, again, brown rice. All that is important. Again, cooked, not raw. Next slide. And losing weight, very easy for me to say, but it's very difficult. Shredding a few pounds boosts your good cholesterol up and brings down the triglyceride levels significantly. So very important. And you're protecting yourself by maintaining a good body mass index. Everybody out there should be below 25, and South Asians, you should be below 23 body mass index. Buy one of those scales with measures body mass index, your weight. It gives you body mass index, gives you your body fat, percent body fat, percent body percent bone density, percent muscle mass, and percent body water, all in one. 30-40 bucks. Quite a few of them are available on Amazon. We use in our screening program, we use what is called in Evi Fit, which is fantastic. I really like it. And that gives pretty accurate, and it measures all of this, and then keep a good monitor yourself, empower yourself, energize yourself to do all of this. Next slide. Cooking tips, again, try roasting or grilling instead of frying. Don't even avoid frying. Avoid all the pakodas and the samosas. If you want to make samosas, make it yourself and then do air fry instead of using oil. And then now there are air fryers available, and use it that way, or bake it, and don't fry it, don't deep fry it. And then again, if you had to fry something, take away all the oil, use again vegetable oil. And then no lard, no lard or no butter. Use vegetable oil. Lard is very bad for you. Again, portion size control, smaller amount. And intermittent fasting seems to help the weight. There is no data for whether it protects you from heart attack or strokes, but if you lose the weight and you maintain it, and you're able to maintain the philosophy of intermittent fasting for 16 hours, 14 hours doesn't cut it. 16 hours is when you start to use the stored fat as the fuel for those last 2 hours, and that's how you tend to lose weight. And then once you lose it, you want to maintain it by doing 2 to 3 days a week, 16-hour fasting. Any 8 hours of eating, you can figure out depending on your lifestyle. Just eat for 8 hours, 2 meals, and then small amounts, portion size, and then fast for 16 hours. And it seems to get the metabolic component down, the weight down, and that in turn will decrease triglyceride level, increase the HDL level, and hopefully we think it'll protect a heart attack. We don't have a data because it's all recent concept. Only time will tell whether intermittent fasting in the long run. What we know is many of our own parents or grandparents or ancestors have been doing this for centuries, and we know that many of them live in their 90s to 100 years, and many of the sages are doing this all the time. Many of them in my own household, they would not eat on Monday night, and then they would have one other day of the week that they don't eat, and so 2 days they would do intermittent fasting anyway. And so there's something about that concept that we still need to explore in terms of what biomarkers is impacting, what biochemical neurohormones is it reducing to protect ourselves and improve the weight. Next slide. So again, smoking, harmful. Smoking is like putting your head into the lion's mouth and hope it doesn't bite you. I use this analogy all the time. That it's just so stupid to put that thing. Once it started, then it's addiction, because now the mind wants a cigarette, and it's a disease. So somehow we need to have the mind lip connection and say to the mind constantly that this, I need to use a celery stick in the form of cigarette, carrot in the form of cigarette, and then keep on chewing on it. It's healthier for you, as if you're you're smoking, and it takes about 3 weeks or so, and then you'll lose the craving for the cigarette. You can do it. Try hard. Nobody dies of quitting smoking. Nobody dies of quitting smoking, and you can do it. And all you need is one puff of cigarette. It ruptures the plaque, and suddenly it's a heart attack, or it's a stroke, and the right side body is paralyzed. You cannot even lift that cigarette with your right hand to put it on your lip, my friends. Think about it that way. Next slide. Exercise extremely beneficial, extremely benefit not only for weight reduction, bumps the good cholesterol, reduces triglyceride level, gets the weight under control, controls blood pressure, controls blood sugar, gives you this euphoric feeling, releases all this dopamine and oxytocin and serotonin and endorphins in the brain that makes you feel good, and positive energy flows everywhere, and you continue to do the right thing, and all of the negatives go down with greed and jealousy and hatred and anger, all get suppressed because of exercise, because these neurohormones are thinking positive about everybody around you, because you start believing that everyone around you has godliness in them. So there isn't any jealousy, there isn't any greed. You're hugging them, embracing them, and love is flowing constantly because you're exercising, because I call it escalate the dose. DOSC, dopamine, oxytocin, serotonin, and endorphin are all increasing inside the blood with exercise, making you feel good about yourself and everyone else around you. So now there's a selfish for me. By doing that, I'm protecting myself. I'm preventing, hopefully, a heart attack or a stroke from happening because of all of the neurohormones that are jumping with joy. Next slide. Supplements are very important. So many of them, we keep asking all these questions. Plant sterols, plant stanols. We talk about all of that. Even prescription niacin, we talk about. We talk about, niacin is found in ordinary supplements, and it's there. Vitamin B. Niacin is vitamin, right? So we have vitamin B1, B2, B3, B4, B5, B6, B7 is biotin, and then we have B12 and B13 is folic acid, right? So B vitamins extremely, lots of greens, lots and lots of greens. Any green, spinach to mustard to broccoli to cabbage to cauliflower to turnip greens to collard greens to rhubarb greens. Any which way, put them all together, chop them up, make them salad, or grind them and make it like and add some tofu or add some paneer, which is a healthier protein. Now you're having a paneer with this altered green, mustard green, like they call in Punjabi, the sarson ka saag, which is again a healthier protein. So all of this gives you not only protein, but also gives you vitamin E, lots of vitamin B and vitamin A. And mushroom, when you add healthy mushroom, vitamin D comes over there. So they're all antioxidants, protects that plaque from rupturing. Elephants are vegetarian. Should you even believe that elephants that only eat, fruits and vegetables and plants and trees and keep going on and on. And they don't get cancer. They have a TP55 genotype that protect them from cancer. Perhaps maybe they're nutritionally altering their own genetic makeup and protecting from cancer as well. We are working on genetic basis of the TP55 gene in humans and see whether we can institute that. But something about the concept, because they will eat a tree filled up with nuts and fruits, so they get all these antioxidants on a regular basis. And very interesting. In nature, we can learn so much from nature. Next slide. Herbal remedies, again, we talked about garlic, artichokes, fenugreek, holy basil, yarrow. We can go on and on and on. Many of them in nature. We make prescription medications from nature. The digoxin comes from a foxglove, a plant. So many Plavix come from ginger. So many of these medications that have been concentrated and made into a pill form is available in nature. But you have to eat so much to bring a pill form. If you need a pill, you need a pill. But don't substitute the pill for, but eat a lot of the available things in nature over a longer period of time in your life, over years, so that they build up over time and protect you from being antioxidant, anti-clotting, stabilizing that inner lining, because a lot of these are healthy for you, and many of them will in the future become prescription medications as well. As we are seeing already, turmeric is now coming in a capsule form, right? And in India, turmeric is like you're born in your bloodstream with turmeric, because everybody is using turmeric for years and years and years. Hopefully it has some very powerful antioxidant, anti-inflammatory properties, and they think that it also reduces dementia, and amyloidosis, another brain amyloidosis, heart amyloidosis coming. All this, we're learning so much on every day. We're learning something new from all of this. Next slide. So again, what to limit, we talked about all that. Next slide.
Yeah, I think we can pause here. I think we have an information overload in that sense, but all of it
Right.
definitely important and very useful information. I think there are a few points that I want to touch upon, and then we'll take the questions and break this session. One of the things that you mentioned about intermittent fasting, right? So traditionally, uh, almost every religion has fasting in built in the religious practices, rituals, in one way or the other. Personally, like I do the ekadashi, which comes every 15 days. It's a so you go 24 hours or more without anything, right? Which is a way of building your immunity and then losing weight and all of those things, so keeping those things in check, which traditionally we had all of that knowledge, but maybe it was not explained scientifically. There is a lot of research now going on about intermittent fasting and the biomarkers that you're mentioning, how it impacts us, and so on. So it is definitely something to do, but also to be mindful, to be conscious of how your body reacts and responds while you're doing it, not just to blindly, starve yourself. And then face the consequences of that. So be really mindful, and also talk to either your doctor, if you have a dietitian, somebody to consult with while you're doing any of these things, right?
Absolutely.
The other important thing that I wanted to talk about, which is the use of ghee. I see none of the slides talked about that. You talked about various other things, but ghee was not mentioned. So do you have any thoughts on ghee? There is lots of difference of opinion, um, but it's now coming back in fashion. It has been something that we've used in India for thousands of years. So what are your thoughts on that?
Yeah. Yeah. So, great question, right? And obviously, there is no right or wrong answer. The what we know is ghee is, again, it's a partially saturated. So there is some dehydrogenation that is going on when you actually heat. So when you're doing when you have butter, and you get the butter from milk, and then you get the butter, and then now you're heating it up. So when you heat, you heat anything. For example, you heat carbohydrate. You form acid, right? So when you eat protein, you form what is called denaturation of the protein, and sometimes you lose the benefit. And then same thing, when you heat fat, you develop you get what is called fatty acid oxidation. Now when fatty acid oxidation happens, and that oxidation is now translating the to insulin resistance concept, which is now translating to onset of diabetes. So you would want to believe that eating higher carbohydrate can lead to diabetes, and eating high fatty food will lead to high cholesterol and a heart attack, right? But there is what is called a crosstalk. So eating carbohydrate can lead to high triglyceride, and high triglyceride can lead to heart attack. I told you the remnant lipoprotein. So it's not just diabetes, but the heart attack. And then eating high fat, you think would increase cholesterol and heart attack, but what happens is the fatty acid gets oxidized when you heat, and this oxidation causes insulin to get suppressed, and then you get an insulin resistance, and the functionality gets affected, and you become pre-diabetic, and diabetes onset comes on. So fat and carbohydrate are so intertwined in both heart attack and diabetes that there is a crosstalk that goes on. So when you heat butter, you get ghee, and thereby there is a dehydrogenation happening. So there is a partially trans fat that is accumulating. Now, as I mentioned earlier, trans fat is not good for you, but something about the ghee there is something significantly beneficial. So now that we mentioned that it can be harmful if you consume a lot of ghee on a regular basis, but if you put a drop of ghee in your food, like for example, we use brown rice and then we use sambar at home, and then we have another curry or sabji as we call it, then you're putting a drop of ghee. Now not only flavorful, but it also important for digestion of many of the vitamins in the body. The vitamin A, D, E, and K are extremely important. So if you have no fat in your diet, then you have to add some fat. And which fat is the healthier fat? A smaller portion of ghee is a healthier fat that actually makes you absorb a lot of these vitamins, which again protects you from antioxidation of the plaque, and protects you with antioxidation and oxidation of the other aspects of biomarkers in the blood. So a small amount of ghee, a drop or two, less than half a teaspoon is okay per day. But when you do it with Mysore pak, two or three, four of them, which is cooked in butter in ghee, not good. Or many of the sweets, even gulab jamun, Indian sweets are made with a lot of ghee. Now, if you consume many of that, not only become diabetic, but it also becoming at risk for heart attack and stroke. So I think controlling, if you get a box of sweets from one of the Indian restaurants or a grocery store. Amazing taste is amazing, but remember, having a little bit of that is healthy because you got some good
Good
healthier
point.
fat. And But then not having anything at all is also you're not satisfying. What am I living for? You want to satisfy your taste buds, and the brain feels good, and you feel good about it. A touch of it, think about it as just having a touch of it, but not too much of it. I think there's got to be an optimum and a balanced viewpoint. So that's the way I would look at ghee.
Wonderful. Thank you. We have another interesting question, right? It's about these high fat diets, such as keto diets, that many people follow for weight reduction. So the question is, are they detrimental in terms of increasing cholesterol levels? What are your thoughts on that?
Yeah. So I refer to a beautiful article just got published by Geeta Sikand, Sikand. She's a dietitian, nutritionist. She's part of my South Asian working group for a National Lipid Association. We are co-chairs, and Geeta is just a wonderful girl. She's written lots of this topic on keto diet and all the different kinds of nutrition. Geeta Sikand is a UC Irvine. She's a professor there. Just a wonderful girl, and we meet up in almost every conference here and there. She's written a recent paper along with Carol Kirkpatrick and many others on the same topic of keto diet and what does keto diet do to the body. Which biomarkers are elevated, what does it do? So the bottom line is that keto diet is useful if you do it for a short term and for weight reduction. There is no uh, translation to protection from a heart attack or stroke. If anything, if you use keto diet uh, with meat products, with high protein from meat, then your risk of heart attack is higher, and you may lose weight, but then you can land up with a heart attack. And I've seen so many of my own friends having sudden cardiac arrest on a keto diet because it triggers off the high meat protein is triggering off oxidation inside the blood vessel and causing the plaque to rupture. Plant-based keto, I have a book that I follow. Plant-based vegetarian keto diet is definitely healthier because the fat and the protein that you get is all vegetarian. And the plant-based, it's mainly from avocado and some of the healthier oils is what they talk about. Again, portions, I would say keto, vegetarian keto diet with portion control of the fatty component is the best you can do, both to protect from a heart attack and to lose the weight. That is, you have to clarify. Keto diet is not all keto diets are good for you. No, some keto diet is good for you where you modified keto diet to a plant-based vegetarian with reduction of the portion component of the fat component, even in the vegetarian plant-based keto diet. That's the way I would look at it.
Okay. Um, Wonderful. I think that is good kind of conclusion to the session. There is another comment: vegetarian sources of proteins have lesser bioavailability as compared to animal sources to fulfill the RDA, and one might end up consuming too many calories. um, your thoughts on the same and role of protein supplements, whey protein, in filling this gap?
So sorry, what is the question again? Whey protein, is that good for you?
Right, right. So the comment says vegetarian
Oh,
sources of protein have lesser bioavailability as compared to animal sources. To fulfill the RDA, you may end up consuming too many calories. So
right.
your
Yeah,
thoughts on whey protein and protein supplement to bridge that gap, so that you're not
yeah.
consuming too many calories, but also making up your protein.
Perfect. Yeah, yeah. That's a very good question. So, yes, remember, the world is filled up with vegetarians. Okay, so the calorie is important to measure, and you don't overboard on calories. And when you say, okay, if I don't overboard on calorie, if I don't eat 2,000 calorie worth of food, even though I'm a vegetarian, then if I eat only 1,000 calorie food or 1,200, then I'm going to restrict the RDA, the needs on a daily average need, required daily average needs for protein or fat or vitamins or elements and metals and sources of heavy, all of that, right? So you worry about all of that. But I would say that those required daily averages, they're all only a hunch, and it is mostly for Caucasian population that has been mentioned for many of them because of their own genetic nature and basis in terms of their own. So if you're athletic and your need to perform on the field, being a basketball player, or you're in high school and you're performing in high school and you're playing games and you need source of calorie and high energy, then you're okay to consume a little bit more to keep the calorie up because you're spending the calorie. So it's about input and output. So if you're consuming calorie high, then you have to expend it as well. So if your needs are high, if you're sedentary, if you're a IT guy, and you're mostly for 14 hours sitting in front of the computer, you don't need 2,000 calorie. You can live anywhere from 800 to 1,200 calorie diet, and that is your required average need. You don't need more because you're not consuming more. So if you're consuming more, then you will need more. But if you're not consuming, don't think that the RDA is for everybody. It does not apply to all people across the world. You have to adjust it for your input and output. And if you adjust it for that, then you will not put on weight. You'll consume just the right amount, and it will just be enough to for brain function and for every cellular function, and it'll be just fine, because that's what our ancestors have said all along. More recently, I think the increase in heart attack and stroke is because of our sedentary habit, increasing stress level, globalization, mechanization, driving cars all over the world and not walking or not getting the exercise that we need. Walking is the best form of exercise, and every day is important. If you want a little bit more, go ahead and play whatever you want, bicycling to jogging to running to basketball to racquetball to tennis to go ahead and do all of that on a daily basis and have a disciplined schedule, so you spend the calorie. And then drink plenty of fluids with instead of calories, you drink plenty of healthy. Don't keep on drinking orange juice and mango juice and guava juice filled with all kinds of sugary stuff. No need for any of that. But eating a lot of healthy salads, so begin with, and egg whites is begin with, you get enough protein if you eat eggs. And if you don't, then nuts, as I mentioned. There is plenty. And don't worry about the RDA being going low. You will be able to function across the board. Just but remember, brain is your god, and have good brain function, avoiding all the negatives, about all the things about negative aspect of life that affects you from losing control of your own consciousness. That's what I would say.
Wonderful. I think with that note, we can come to a close of this session. There is so much information for anyone who's interested in understanding your diet, your cholesterol, and then this leads very well into the first two sessions on diabetes and hypertension that you've looked at, and how you can add this to manage those things better, but just to simply live a healthy and happy lifestyle, right? So there is so much in this session. The recording will be available on various platforms. right? And we
So I
will
still have some more
definitely.
slides, right? Daya, I still have some more slides
Yes,
about
yes, but
medications.
we
Are we
will
going
have
to
to
go
zoom
there or
into that.
no?
We're already an hour and 20 minutes into this
Okay,
session, so we will maybe we'll consider adding some of that into the second session, or doing
fantastic.
another additional follow-up session on this, but because that will take probably another hour or so.
Okay,
I think with that we will close this session. We will have a follow-up session on cholesterol with two of our experts coming up soon, right? And all of this will be available. And thank you everyone for watching this. Thank you, Dr. Chris, for your time. Thank you, Martin, for setting this up. Thank you to our beautiful interns, Alankruta, Gurpal, Redima, and we have Sharanya, who's joined us as well. So we will be back with the next episode of this season in 2 weeks from now. Thank you everyone for watching, and namaste.
that was it. Thank you for having me. Thank you. Bye bye now.